All right. Hello, everybody. I'm Jimmy Panetta. I'm the U.S. representative for the Central Coast. We're doing these internet conversations. And obviously during this pandemic, but, as this pandemic persists, we understand the physical concerns that we have with this, especially considering you have in our country over 1 million people who've contracted this unfortunate disease, and 70,000 people, once again, 70,000 people have actually perished from contracting this disease. So yes, there are definitely physical health detriments that can occur, but we also need to take into account the mental health issues that are rising as we go forward in this pandemic. And you can pretty much guarantee that everybody, including myself, are being affected by this pandemic in one way or the other, especially when it comes to the emotional status of people. And I think a lot of that has to do with the fact that there's so much uncertainty. Now and it's leading to, and it demonstrates this because you got half of all Americans saying that their mental health has been affected. 3 of 4 Americans, their sleep has been affected by this as well. Now, this month is Mental Health Awareness Month. And so I'm doing these webinars to talk about federal issues, but also the local resources in our community for people here, especially when it comes to issues of mental health. And I think we all know that we can all sense why it's happening, why we're all feeling this way. The fear and anxiety of getting this disease for you and your family and your friends, the loss of work, loss of income, the stress of providing food for your family. I just came from a food bank in which a delivery service where people were lining up to get the food that's provided by our food banks. Child care issues, having to teach the kids who are at home, strained relationships from being at home with their kids or with their partner, overcrowding in your home, or loneliness and isolation in your home. The fear and anxiety it creates by doing things that we normally do without even thinking about it. But now you got to make sure you have your mask, got to make sure you have your gloves when someone approaches you. Do you not handshake them? Do you elbow bump them? What do you do? These little things that are adding up. And the feeling that, will it ever be normal again as we know it? And so it's clear that there's an amount of stress that's culminating. And I believe that it's affecting all of us in one way or the other. There's no doubt about that. Now, I know we're just beginning to fully understand what this virus has done or will continue to do as people continue to stay at home and abide by these orders, but also what it's doing to people's mental health and physical well-being. And yes, there's been a lot of focus on doing the things that we were supposed to do, staying home and washing your hands, but often the mental health issues can be forgotten and not focused on enough. But I'm telling you, if you read this article, there was an article on May 4th in the Washington Post, and I just want to quote a couple lines. They start off by saying, 3 months into the coronavirus pandemic, America is on the verge of another health crisis, with daily doses of death, isolation, and fear generating widespread psychological trauma. Federal agencies and experts warn that a historic wave of mental health problems is approaching: depression, substance abuse, post-traumatic stress disorder, and suicide. And so there are a number of issues that we're not just dealing with nationally, but obviously locally. And that's why I feel so lucky to have with us Rudy Escalante, the CEO of Janus of Santa Cruz, who was also a police chief in Capitola for about 4 or 5 years.
Yes.
But also a homegrown boy, somebody who is from this area and has learned to give back to this area and did that throughout his career. And fortunately for us, continues to do that in his current position as CEO of Janus of Santa Cruz. And so we're going to have just a little bit of a conversation with Rudy for the next few minutes, talking about Janus and what's out there for people who are not only experience mental health issues, but also know of other people who are going through these tough and difficult times, and how all of us together can get through this pandemic in one way or the other. So Rudy, thank you very much. Appreciate this opportunity. Appreciate you joining us. Do me a favor. Let's start off by telling the public about Janus of Santa Cruz and what work Janus does to help our community members?
Well, thank you, Congressman Panetta. I appreciate the opportunity. Janus has been in our community since about 1981. We're a nonprofit organization that works with drug and alcohol treatment facility that provides services to community members here in Santa Cruz County and abroad. We have a wide variety of services. We have a perinatal facility that houses women with children. It's the only one in Santa Cruz County. We also do withdrawal management, which is the only organization right now that does that. And then we have our residential, our methadone services, DUI services. And we also have the option, and we're bringing back our outpatient services. Along with that, we have Lighthouse counseling services where we have professional therapists who can provide counseling services. And so we have a wide variety of opportunities to assist our community, and we work strongly with our community partners and the County of Santa Cruz Health Services Agency.
That's great. Now, obviously, in this day and age where, with this pandemic, we're telling people to do the exact opposite of what, needs to be done to a certain extent. We're telling people to stay at home. We're telling people to isolate themselves. We're telling people that it's okay to watch Netflix all day long as you stay at home and abide by the shelter in place orders. If people are staying at home, how can they get your services there at Janus?
So one of the adjustments that we have made since the shelter in place order has been to implement telehealth services. So our counseling services, DUI services, those are all telehealth opportunities along with methadone as well. Counselors are working remotely. I would say about 50% of our 150 employees are working remotely so that we can continue those counseling services and check in with our clients as much as we can. We also have our Lighthouse services where our therapists are seeing clients remotely so that we can continue those services because people are experiencing high vigilance in regards to fear and anger and anxiety, and we are seeing that in abundance here.
Understood. It's in this article that I talked about from the Washington Post 2 days ago. One of the things they say is there's an online therapy company that reported a 65% jump in clients since mid-February. Are you seeing an increase in clients at this point?
We're seeing an increased demand in those telehealth services. What we are seeing a decrease in demand is people are very fearful of coming into a living situation. And they're also seeing this in emergency rooms where they're just afraid to come into treatment. So we have tried to make all the accommodations we can, make it administrative and engineering changes to make the facility as safe as possible, individual meals, keeping our social distancing, clients wear masks, the whole intake process we do by the phone, and then we do an in-service. We take temperatures twice a day of clients. The staff does self-assessments as well. And so we've done a lot of those measures to make sure that people are safe. We typically use 2 rooms or 2 clients to a room. We now have 1 client per room so that in the event they become symptomatic, we can transfer them and keep everybody else safe in the facility.
Yeah. It was interesting. I was talking to somebody who went into a liquor store, and they said, obviously with people, at home, I would imagine that your sales and your businesses is taking a hit. And they said, not at all. They said, actually, right now, our sales when it comes to alcohol has been through the roof. Have you seen these types of effects with substances use and going through the roof, or substance abuse, not just with alcohol, but with drugs?
We're seeing where online sales of alcohol have gone in upwards of 200% increases. We've also seen a lot of DUI arrests that have been occurring from our local law enforcement because we operate a sobering center in partnership with our county sheriff. And so we've seen those increases both on the alcohol and the drug side.
Yeah. Now, as I've said in the strategy that we've been a part of when regards to the governmental response to this, Really haven't seen a unified strategy throughout this country, but what we've seen instead is what I say is federally funded, state mandated, locally executed. Now, you and your position and everybody, all of your employees there at Janus, they've been the one on the front lines. You guys have definitely been helping execute the strategy with the resources that you have been provided, that you have, and that have been funded either through the state or through the federal government. How are you doing? Is more funding? I mean, I know you're going to say we always need more funding. I get that. But how are you doing? Are you able to have and provide the necessary services at this point with this pandemic going on?
I think one of the challenges we shared, and our county partners have been terrific in supporting us, is trying to get personal protective equipment. That has been a challenge, not only just for us, but for our county providers as well. And we are an essential service that has been identified by the Department of Healthcare Services. So we are required to continue those services. And so maintaining those levels of PPE is just enormously critical. Yeah. And for us, that is our biggest challenge, is that we understand there's higher, more serious needs in regards to our healthcare workers at the hospital and those who are actually confronted with the virus itself. But we do engage in a medical side of it where we do physicals and histories on clients. And so we are close to them. We do, like I mentioned, we have a longer assessment process, and some people find that difficult to get through, but we are trying to identify those who may not be symptomatic yet, but are asymptomatic, to prevent them from coming in the facility as best we can.
Yeah, understood. Are you working with your local Office of Emergency Services for that PPE?
Yes, our county has done a great job in developing a process, and they've been very helpful when that need comes. We've also reached out to other community partners. The community of Santa Cruz has always been fantastic when asking for help. And so from hand sanitizer to shields that we've had made, private donations of masks, all of that equipment has come forward for us when we've needed it. So our community has really been fantastic.
Great, great. Now, moving on to, there are obviously with mental health, sometimes it's hard for the individual to acknowledge, to see the effects of what's going on. And obviously it can be left up to those around that individual. And so do you have any advice as to what a loved one can do, or what signs we should be looking out for when you see individuals with either substance abuse issues or mental health issues?
Obviously, isolation is a key factor to it, and irritability, somebody whose mood swings have really changed. A lot of people's patterns are now being disrupted. Prior to the pandemic, people had a pattern or how to do things and how to cope through daily routines. That has significantly been changed. And so you're seeing enormous trauma from people on how to adjust their lives. And it's very unstable for them. And so there's that amount of anger and fear and frustration where people get short-tempered. They lack the appetite. They can shut off. They don't engage as regularly as they used to. And so those are all things that people need to be aware of and to seek professional help for that.
On that last point, what can someone do when they see these signs and symptoms? What do you think we should first do? What's our first step?
I mean, obviously the first step is, try to care for a loved one as much as possible. And, that type of intervention can also trigger somebody into another path that could be quite a bit more destructive. And so any type of professional involvement in that intervention should be done by somebody who's trained. But as a family member, having those communication skills, being able to sit down with somebody, or maybe even talk to a professional about how do I engage my loved one? I'm seeing this. And there's a lot of resources in the community to contact and say, I need some help on how to address this with my loved one at home because I am seeing these symptoms.
Yeah, yeah. It's funny. I know we started off and it's sort of taken a hold, the words of social distancing. But I've heard a lot of people say, don't say that. Use the word of emotion or, physical distancing. Physical distancing. I don't know if that's going to take a hold. But in regards to, the type of isolation that we're seeing now, how can people respond to that? What can people do to prevent the type of isolation that this pandemic has created and that our government officials are actually asking people to do?
So we've been seeing a lot of apps out there where people, Nike has an app to get people to exercise and motivate more, where they can actually be at home and do different things that maybe they used to be doing in regards to their physical health and their mental well-being. And there are apps out there to practice those exercises or participate in a new path as to how to take care of your mental and physical health. Obviously, eating right is always important. Anytime we engage in more activity in regards to tobacco use, alcohol, drug use is going to elevate those concerns. And so I think there's ways that people can explore in certain apps that have been developed to work on those mental health and physical well-being. Obviously, taking walks, and we've seen communities where they've closed off to the street to any vehicle traffic, and they've allowed people to walk and maintain those distances. But at least getting out and engaging and being aware of the surroundings so that you can be safe and also get out and be engaged as much as you can.
It's funny. For Christmas, I bought my family one of these interactive physical exercise machines that you can, get online, and it comes through a mirror that's there. And, at first it was all right, but I tell you, I'm a hero right now because they are using that every day. And I think it really does help all of us, to be honest with you, when we engage in some sort of physical exercise. And then if we have the opportunity to do it together as well. But obviously, people are alone. And we have people who are vulnerable to this type of disease, elderly, disabled. Would you recommend continuing to reach out to people like this repetitively? How often?
Yes, I think weekly check-ins are good. It's also important for people to understand that those most in need, some of them don't have cell phones or Wi-Fi service or computers. And so not everyone is available for these telehealth services. And so anything that we can do to address that population as well is going to be helpful. And that's kind of where we like to come in, is that we make those services available. But, checking in on a weekly or bi-weekly basis to see how things are going. And we try and do that here so that we can stay on top of those issues as they start to develop before they become too mountainous.
Yeah. Oh, it's funny. I had a few of these Zoom meetings today with people back in Washington and throughout the country, members of Congress, I should say. And I can tell you, telehealth came up quite a bit and how beneficial it is. But at the same time, the realization that there needs to be more of it, and people don't necessarily have the technology that's out there. Are you running into that here locally with people not having this technology?
That's true. We are seeing that. We also see that with some of our staff members as well, to where they do not have the capacity to do that at home. We've had to pick up additional technology that allows them to use their cell phone, and the receiver, the phone call, cannot see their address or phone number or name. This way we maintain privacy. We have confidentiality concerns that we have to deal with. We have consents that we have to deal with. And so folks who don't have that capability to either sign on electronically and approve that, we have to then find other means to make that happen so that we comply with the legal requirements that we are bound by.
Understood. Understood. I can also tell you, though, that obviously there was funding in the past, big packages that we've passed recently in Congress have been signed into law, funding for telehealth. And I can tell you, based on the discussions that I'm having in Washington, D.C., there will be continued funding for telehealth as well, just to let you know going forward. Any other thoughts or resources that you can provide for the public as we wind things down here in this interview?
I think that we're going to continue to explore all other remote options that we can. We've always talked about withdrawal management, which is an inpatient type program because you require a medical oversight for a period of time, and how we can advance that process to where it is a take-home withdrawal management, to where prescription medication can be utilized for somebody to go through withdrawal management at home rather than an inpatient facility. At least it's another option to explore. So in this instance where people are afraid to come into treatment because of contracting the virus, at least they would be able to be at home and then continue with outpatient services via telehealth or other means.
Yeah. And just as we wrap up, if you could provide the public with the contact information that they can use if they ever want to get a hold of Janus or some of your excellent employees there.
Thank you. So we can be reached at 831 area code 462-1060 or at www.janussc.org. And we have our admissions department that can help process a person's admission and do an assessment so that we can get them in the appropriate treatment.
Great. Once again, if you want to get a hold of Janus, that's 831-462-1060. And I can tell you that if anybody ever needs help from my office here on the Central Coast, you can call us at our Santa Cruz office at 831-429-1976. Once again, that's 429-1976. And we are not physically in the office. We're abiding by the stay-at-home orders. However, we are answering the phones. We are working remotely, and therefore there will be people answering your phone calls 9 to 5, Monday through Friday. And if for some reason they're on the other line and you get the voicemail, please leave a message. Once again, for the office of Congressman Jimmy Panetta, you can call 831-429-1976. Rudy, I want to thank you very much, not only for your time today, for the information that you provided all of us, but obviously for your service now as CEO of Janus, but also ultimately all of your service to this community throughout your lifetime. And I look forward to continuing to work with you as we get through this pandemic and get to the other side of it, as I know that all of us will do together, especially with the services that Janus provides to our Central Coast citizens. So once again, thank you, Rudy, and I appreciate what you're doing and appreciate this opportunity.
Thank you, Congressman, and my best to your family, and stay safe and healthy.
Thank you. Thank you, everybody, for joining us.